Welcome everybody to the show. I'm your host Stephanie Bainum. My co-host Alex Delgado, well, she is off for today. But first, we're going to turn to an important topic for women everywhere. Breast cancer is the most common cancer among women in the United States, other than skin cancer. And according to the American Cancer Society, it is also the second leading cause of cancer death in women. Now, getting regular mammograms can be a life-saving procedure, especially if you catch the cancer early. Now, the mammogram technologists at Adventist Health Breast Care Center focus on making you feel comfortable in performing these life-saving breast exams. And joining us now today to tell us all about it is Kathy Wilson, who is a mammography technologist from Adventist Health at the Breast Care Center in Hanford. And we're also joined by RN and Breast Cancer Center Manager Lori Sherling. Thank you, ladies, for joining us. Such an important topic.
Thank you.
Thank you. And so first of all, talk about mammograms themselves. What's the process like?
Well, we are actually compressing the breast to take a picture, to spread out that tissue and see. We look for little minute calcifications. We look for anything, any abnormalities in the breast at all. Anything that's not uniform, anything like that. So it does involve some compressing, but it only lasts a few seconds and it's not long. And then the radiologist will read it. They'll compare with your old, if there is old films, they'll compare with those too.
And Lori, many people, the first thing they ask is it painful? What would you say to that?
It's not painful. It's a short process. It's only a few seconds that they're in compression. But if you think about compression, the reason we do it, it's kind of like if you take pie dough and you roll it out to find that raisin.
Right.
That's what we want to have happen. We want to have that thing be able to be visible.
And I asked you ladies earlier, when is the time that women should start doing this?
Age 40. Once a year after the age of 40.
And that's important for our viewers to listen to, because I know growing up I heard it was 50, but that's not the case anymore.
No, it's 40. And you don't, a lot of women believe they stop having mammos after a certain age. You do not stop having them, because actually the older you get, your chances even increase with age. So you do not stop having them, and you want to start at 40.
Unless you have family history, then you want to be talking to your doctor, because there are other things we can be doing too.
Really?
It might start a little earlier even.
Wow.
Exactly.
So in terms of it's never too early enough if you might have some family history, would you say?
The problem with that is just that breast tissue is so dense in younger women, it's hard to see through. So the better thing for younger women is to be absolutely doing self-breast exam, and the physicians should be doing clinical breast exams to make sure, and then if they have a problem, you know, definitely the physician will then refer them over to us.
And I think this is a question that many people have but don't want to ask. What if someone has breast implants?
No problem. We do their we do several of them a day at least. There's no problem. The implant can hide part of the breast tissue, and we have to take a little more exposures than normal.
Right.
But we do them all the time.
Okay.
Yeah.
So it's fairly common. Don't be embarrassed.
Right.
Just go in there when even if you have breast implants. It's just so important.
Yes.
And Lori, talk about the lives that you saved with mammograms.
We save about 3 out of every 1,000 women that we screen. And the thing that's good about this is we can see things on mammos 5 to 8 years before you can feel them.
Wow.
And so we're catching early cancers. And I will tell you, the whole last year I only had 2 that were stage 4. I've been doing this for about 30 years, and it used to be stage 4s when we saw them. So today we're seeing them stage 0, 1, 2, and these ladies are living. 98% of women live with breast cancer today.
That's incredible. So Kathy, it really is all about catching it early.
Yes, that definitely. That's why we say start at 40, do it every year, don't skip, and don't stop.
Don't stop and don't be scared. So can you remind people, Lori, where you are located and how people can get in touch with you?
We're at the Breast Center, which is in Hanford, at 125 Mall Drive, and Hanford, and our phone number is 537-2300.
And if women have questions, there's no stupid question, right?
Absolutely. Right. They can ask us the same thing 10 times. No question is stupid, because they don't know. you know, and we don't mind answering over and over again.
And in terms of insurance, we don't have to get into nitty-gritty, but are most insurances understanding of women having to get mammograms?
Yes, and there are programs for those women who do not have insurances. There are a couple programs out there that we can, well, the clinics and the different doctors can set you up with.
Okay.
There's a Links for Life, there's a early breast detection, so there are programs too that will help those women who have no insurance.
Right.
There's no reason for a woman not to have a mammogram, because if they don't have insurance, we'll work it out. We'll get them a mammogram.
You'll work it out. Well, thank you, ladies, so much. Adventist Health, the Breast Care Center. Definitely go visit them, and don't forget to get that yearly mammogram. Thank you, ladies.
Thank you.
Great information.